Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Top 7 exercises after a meniscus tear and how to get yourself some pain control.
Yeah.
That's the topic today, Brad.
Exactly.
Are you surprised to hear that?
No, Bob, I'm not surprised.
You wrote it. So, and by the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also go over to the Facebook where Brad and I really have this deep desire to be liked. So hit that like and we're off and running.
If you like us, we'll like you.
That's right. All right, Brad, what's the first exercise we're going to do?
Okay, so meniscus tear. This could be after a meniscus surgery as to a similar protocol, but you're going to have to move, Bob.
Oh, I will do that.
Yep. Out of the way, out of the way. First of all, these exercises, I put it under one, but it's really 3 separate little exercises in the one, is working on the hip, the quads, and basically the hip and the quads.
Sure.
Okay? So we're working above the joint to stabilize that joint.
A lot of the muscles run down across the joint,
Sure.
coming from the hip.
Yeah.
So,
The first one we're going to do is it's pretty simple. Lay like this. If this is the involved leg, right there, we're going to keep that knee straight. This one's going to go up like this, and oh, Bob, you're going to give me a pillow?
yeah, you didn't look comfortable.
Oh, thanks. Now I know you care.
What's nice about this is you're strengthening the knee without putting stress on the knee.
Right.
It's basically an isometric strengthening technique, really.
You bet.
So,
You betcha.
Pretty standard here to do these.
And this is one of those that looks pretty easy. It's not real difficult, but you got to remember you got an injured knee, and these muscles have not been working like they should be.
Yeah, you may actually have a lag in it when you start off with.
Right, so you might be coming up like this.
Yeah, you may have trouble keeping it straight.
Right, and the goal is to keep it perfectly straight while you do the whole lift. Then you get a little hamstring stretch in there as well, the higher you go. And then we're going to go sideways, again with this leg, and we're going to lift like that.
Yeah, we're good.
We're clear, Bob?
Yeah, I never checked our sound, and everybody's been complaining about our sound lately. I want to make sure.
I apologize that we do what we can here.
Yeah.
Now this works the adductors. These muscles are typically not as strong as the quads, and you'll feel it when you're working these.
Yeah, this will be harder for you.
And we're gonna do about 10 to 15 of all these, and then finally.
So he's going around the world here.
Yeah.
He's catching the front, inside, outside.
Yep. Okay. Number 2. All right. This is one where we're going to work the hamstrings. We want to make sure our hamstrings are strong, and we're going to do it in an isometric fashion, so it's going to not work with the joint, because remember the meniscus is injured and it's healing. At the same time, we don't want to let the hamstrings get weak. So to protect the meniscus, we're going to do an isometric. Bob, can you show which direction I'm digging my heel in?
He is pushing down into the bed like this.
Right, so there we go, and my hamstrings are going. I'm going to count up to 10, 1001, 1002, all the way up to 10, and then relax. And then I'm going to hold it again. I'm going to do 3 sets of 10 on these, assuming it doesn't hurt the knee.
Do you think it'd be too much to do bridging on that, Brad, or not?
Well, that's something that you could do. It kind of
Because if you
relates to
did it
the
with
next
both,
one.
and if you lift up, you're doing very little movement on the knee.
Sure, that's a good point. That's a good option, Bob.
I'm just wondering if it would be one to try.
Sure. As a matter of fact, we could get the ball in here on this. I don't know if we want to do that right now.
Sure, and pushing into the ball. Why not? We're on the.
Well, of course, Bob. Get the red one.
We're spontaneous.
We
here.
like the. So.
If you have a ball.
Yep.
If you don't have a ball, you can do just what you're doing.
And now you can see. I'm just going to push straight down.
Yeah.
You can see the direction of the force by the ball on my foot. And this is a really nice way to get that isometric.
May the force be with you, Brad.
There you go, Bob.
And then you could even do a little bridging on this too, right, Brad?
I could go up like this.
See, and again, you can see he's not moving the knee really. He's just moving his butt and his hips so that he's strengthening the knee without putting stress on it.
A lot of hamstring there.
Yeah, this is going to be a tough one though, probably after surgery.
Sure.
If you haven't had surgery, this is one you should be able to do.
And with the ball, then you could do some range of motion here to see how far you can bend it. Okay, and straighten it out. Okay, if you don't have the ball, let you take that, Bob. You can use a device like this. We call it the knee glide because that's what it is. And this works out really well. You can put this in the bed. It's not so bulky, and just do some sliding with that all the way up as far as you can.
Now these, all these products, if you're interested, we have them in our list down below,
Right.
so you can click on it.
You bet. Bob, and the nice thing about this is that you're not going to get with just putting something down on the bed or the floor, is we can elevate it. It's a little thing, but it helps get that emphasize that
Well,
hamstring strength.
The other thing is when you're on the bed, you can't slide very easy.
Yeah, you got to put some plastic down,
Yeah, or
or
something.
it doesn't work
It
near
just doesn't work.
as
right.
nice as this.
So,
Okay. All right. Now, don't put that away, Bob.
all right, I won't. You know, I'm one that likes to clean up all the time.
Yeah. Ask his
That
wife
could be
about
clo-
that.
It could be farther from the truth. Okay, where are we at, Brad?
All right. The next one's sitting on the floor. It's basically
Not sitting on the floor, foot on the floor.
foot on the floor, seated
Yeah.
in a chair. It's basically what we're doing there, except for in the seated position. So it does change, and you can take a towel and put it on the floor. But why don't you grab that knee glide, Bob?
Oh, sure.
Because this is nicer to use. And again,
So we're starting to get some knee motion is what you're trying to do.
right. And here you're actually getting a little more weight through it. And as you lean forward, you can push down and introduce a little weight in through that joint as you're working the motion. So it's that whole idea of movement with the stress on the joint so that it's going to help it heal.
And again, as an alternative, you can put a towel on the floor
Yep.
and slide back
Sure.
and forth.
With a towel, you can't do this. So, and this makes, in the seated position, you really feel the difference on the hamstring work with this particular device. So, and we do want to get full range of motion. And, you know, you may test it out like this, you know, and stretch it all the way here.
Yeah, even after a meniscus injury, you can try to stretch it too, if it's not, as long as it's not painful.
Right. Yep.
Pain has always got to be your guide on
Yep.
these things.
You've got to listen to
So,
your body.
Right.
All right. Now,
Now, what do you have in mind, Brad?
well, we got to straighten the knee. We talked about
Okay.
bending it, range of motion, a little
Sure.
more weight, but we have not addressed full extension or getting that knee as straight as it needs to go, which is right to there. And now, if you're to here and it's blocked, and you put the other leg up and you can see that it's lower, we need to get that fully straight.
Right.
So you
right.
can do it using a stool like this works well. If you
It
have
does work well.
If you have an office
Yeah.
chair, something with
It's
wheels.
good dynamic
Yep.
stretching.
Then you're going to work it. You can use the other hand here, not on top of your kneecap, but around your kneecap, so it's not painful, irritating the kneecap. And you do the old pressure on, pressure off, pressure on, pressure off.
I think it works good to do both a little bit. You know, the pressure on, pressure off, and then even some sustained stretches where you hold it for a minute.
Because we
30
want to make
seconds.
sure we give you everything. Should we even show them the prone hang, Bob?
Sure.
That's even.
Want me to do it?
Yeah, go ahead. So he's going to lay prone on his stomach, and
So I'm letting it hang. I got my knees still on the bed, but the rest of the leg is off the bed.
Now, this all depends on, if your kneecap is uncomfortable here, you may have to move your body off a little bit. So
And
that
also, you could put a pillow there, I guess.
Sure,
but-
yep.
But this is a lot more comfortable.
there. Now, what'll happen here is if you put both legs there, as a therapist, what I do is I look at it and just compare right to left. And that's what's nice with working about legs. You can always compare with the good leg to the bad leg. And, you know, if this was his bad knee, you can see it needs to go straighter. So with time, now usually this is not real comfortable. You feel the stretch, and if you have sharp pain with it, you probably should back off and maybe go with the other more controlled route in the seated position. But if it just feels like a stretch, you can hang your. I've had people like this up to 5 minutes.
You can put an ankle weight on there.
Yep.
Yeah.
Yep.
And you can also do a little bit of this.
Yep. So he's going to assist with his leg, but I don't have someone else help because
Right.
there's way too much leverage on there.
This way, they're in control. They know how
Right.
much they can tolerate. And again, they're going to allow pain be their guide.
Right. And people are much more relaxed when they're in control.
Right.
Versus someone else having the potential to create pain.
Exactly.
Yeah.
All right, we're up to number 6, Brad.
Oh.
We'll probably have added a few more from then, but
Well, those are bonus, Bob. We always
Yeah.
like to give bonuses.
that's right.
Why, Bob? I'll tell you why. Because we like to. Okay, get something to hold on to. And we're just going to do some squats with both legs. Now, if your knee's if you first started that, I'm going to put more weight on my strong leg and this kind of test how we
You still want to try not to have the knee go past the foot, right?
Right. Good point. You want to grab it? It's over there, Bob. Once again, Bob is keeping me in line.
Yeah.
So if a vertical plumb line right from the toe, you don't want to be doing this. We want to keep it behind.
Right.
There, like that. And then we're not going to go past 60 degrees, which 90 would be down here. You don't have a goniometer, but we're going to show you. It's about right to there.
Yeah, there's very little stress on the meniscus at that level.
Sure.
At 60.
Yeah.
It's when you start getting deeper that's where you start putting a lot of stress.
Right.
A lot of times these are a lot easier to do with the ball again. We're going to go back to the ball on the what?
The ball on the wall.
Ball on the wall.
There's one more point I want to bring up,
Oh,
Bob.
sure.
Because it's the same with that. If you look at the line straight ahead, make sure that your knee does not go in. That's a typical. It could go out, but most people's knees have a tendency to go inwards. We want to keep it right in line. Okay, so we keep the joint where it needs to be.
Very good point. But these are a lot easier to do to me because it's so easy now to keep my knee behind the foot.
Yeah.
I mean, it's just,
Right.
you're just really in control.
And some of the body weight is on the ball, so
Yeah.
it's a really good progression into that getting knee through the joint, getting the muscles stronger, getting functional. That's what we're all about, Bob, is getting functional.
That's right.
Right. We're just not puppets on the wall.
All right, one step up on the stool.
Yep.
Where's the stool?
And this one's really getting more advanced for strengthening. I'm going to use this chair here, and right behind you, Bob, is
A cane?
Yep. This is nice to do in a stairwell, which we don't have here. But now with this one, you want to make sure the knee stays over the toe. It doesn't go in like this. And this way, the knee, so it stays behind the toe, as we mentioned already. And if you have on a stairwell, you can hang onto the stair.
Yeah, it works out
rails.
really well with
Yeah.
that.
And this works out fine too. I'm going to just go up like this and down. Why don't you grab that white PVC pipe? It won't move, Bob.
Okay.
Yeah. And the show in front.
Oh, that you're going on
Right.
straight, staying straight.
So yeah, because that black on, like that. And look at this. I'm not pushing off from here, but I got my toe pulled up right here, and I'm going to touch my heel, making sure those quadriceps are doing as much work as they can. And I'm not going to go in like this. We're going to go straight in line and up. And
Really important.
Yep.
That's not a minor point.
So to start out with, I'm going to use both hands to help push up and down because gets difficult. Then I'll take one hand off, and when you get really good, you can try to do it with no hands, and that really works the quads well.
And then when you get really good, go up there again. I can start whacking you. So that
Yeah, little perturbations.
That's right.
Yeah, in the therapy world.
Yeah.
But is that what they taught you in school?
Oh yeah, we love pain and torture. So, all right. Thanks everybody for watching.